Managing hypertension effectively involves more than just medication. It requires mindful dietary choices that can significantly impact your blood pressure levels. The diet for hypertension focuses on foods that support heart health, help relax blood vessels, and reduce the strain on your cardiovascular system. In this video, we'll guide you through what to eat and what to avoid if you have hypertension. You'll learn about nutrient-rich foods that can lower blood pressure naturally, as well as common dietary pitfalls that can worsen your condition. Making informed food choices is essential because what you eat directly affects your blood pressure. Certain foods can cause spikes while others help maintain stable, healthy levels. Understanding these differences empowers you to take control of your health. Whether you're newly diagnosed or looking to improve your current management plan, adopting a diet tailored for hypertension can make a meaningful difference in your well-being and reduce the risk of complications. Let's explore the key foods to include and those to limit or avoid to support your journey toward better blood pressure control. Eat number 1, vegetables and fruits. Vegetables and fruits are foundational components of any diet for hypertension due to their rich nutrient profiles and natural ability to support healthy blood pressure. Packed with essential vitamins, minerals, fiber, and antioxidants. These foods help relax blood vessels, reduce inflammation, and balance sodium levels in the body. Potassium-rich fruits and vegetables like bananas, oranges, spinach, and sweet potatoes play a critical role in managing hypertension. Potassium helps counteract the harmful effects of sodium by promoting its excretion through urine, thereby reducing fluid retention and lowering blood pressure. Leafy greens such as kale and Swiss chard are especially high in potassium and magnesium, both of which contribute to vascular relaxation and improved blood flow. Fruits and vegetables are also abundant in antioxidants like vitamin C and flavonoids, which protect blood vessels from oxidative damage and inflammation. These protective effects help maintain the elasticity and function of arteries, crucial for stable blood pressure levels. Moreover, the fiber content in fruits and vegetables supports healthy digestion aids in weight management and improves cholesterol levels, all of which indirectly influence blood pressure control. Incorporating a variety of colorful fruits and vegetables into your meals ensures a broad range of nutrients and maximizes their beneficial effects. Aim for at least 5 servings a day, including both raw and cooked options to keep your diet balanced and heart healthy. By prioritizing vegetables and fruits, you're embracing a natural and effective way to support your blood pressure management and overall cardiovascular wellness. Eat number 2, whole grains. Whole grains are an essential part of a balanced diet for hypertension, offering numerous benefits that support healthy blood pressure levels and cardiovascular function. Unlike refined grains, whole grains retain all parts of the grain kernel, the bran germ, and endosperm, providing more fiber, vitamins, minerals, and antioxidants. One of the key nutrients in whole grains is dietary fiber, which aids in digestion, promotes satiety, and helps regulate blood sugar levels. High-fiber diets have been associated with lower blood pressure and reduced risk of heart disease. Fiber also helps lower LDL cholesterol, often called bad cholesterol, which can damage arteries and contribute to hypertension. Whole grains like oats brown rice, quinoa barley, and whole wheat contain magnesium and potassium minerals crucial for relaxing blood vessels and balancing sodium in the body. These minerals work synergistically to reduce vascular resistance and promote healthy circulation. Research shows that diets rich in whole grains are linked to modest but meaningful reductions in both systolic and diastolic blood pressure. For example, oats are well known for their beta-glucan content, a soluble fiber that has been shown to improve heart health and lower blood pressure. Incorporating whole grains into your meals is simple and versatile. Swap white bread for whole grain bread, replace white rice with brown rice or quinoa, and enjoy oatmeal for breakfast instead of sugary cereals. Cooking with whole grains adds texture flavor and nutritional value to your diet. Choosing whole grains over refined grains also helps stabilize blood sugar and insulin levels, reducing the risk of metabolic conditions that can exacerbate hypertension. To maximize benefits, aim for at least 3 servings of whole grains daily as part of your diet for hypertension. Pairing whole grains with plenty of vegetables and lean proteins creates a heart-healthy plate that supports blood pressure control naturally. Eat number 3. Lean proteins and healthy fats. Incorporating lean proteins and healthy fats into your diet is crucial for managing hypertension effectively. These nutrients support heart health, reduce inflammation, and provide sustained energy, all while helping to maintain healthy blood pressure levels. Lean proteins, such as skinless poultry, fish, legumes, and low-fat dairy, offer high-quality protein without the excess saturated fats found in red or processed meats. Fish, especially fatty varieties like salmon, mackerel, and sardines, are rich in omega-3 fatty acids. Omega-3s have been shown to lower blood pressure by reducing inflammation, improving blood vessel function, and decreasing blood clotting. Legumes like lentils, chickpeas, and beans are excellent plant-based protein sources packed with fiber, potassium, and magnesium minerals that play vital roles in blood pressure regulation. Low-fat dairy products provide calcium, which supports vascular contraction and relaxation. Healthy fats from sources such as olive oil, avocados, nuts, and seeds help improve cholesterol profiles by increasing HDL good cholesterol and lowering LDL bad cholesterol. These fats also have anti-inflammatory effects that benefit blood vessels and reduce the risk of hypertension-related complications. Replacing saturated and trans fats with healthy fats is a key dietary strategy recommended by heart health organizations. This means limiting foods like butter, full-fat dairy, fatty cuts of meat, and processed snacks while focusing on unsaturated fats. Incorporating lean proteins and healthy fats is simple and delicious. Use olive oil for cooking and salad dressings. Snack on a handful of nuts, enjoy avocado slices on toast, and include fish in your meals at least twice a week. A diet rich in these nutrients supports vascular health, reduces inflammation, and provides essential building blocks for your body's functions, all of which contribute to better blood pressure control. By prioritizing lean proteins and healthy fats, you create a balanced, heart-friendly diet that naturally helps manage hypertension and promotes overall well-being. Avoid excess sodium. Limiting sodium intake is one of the most critical dietary changes for managing hypertension. Excess sodium in the diet causes the body to retain water, increasing blood volume and putting extra pressure on blood vessels, which elevates blood pressure. Sodium is commonly found in table salt, but much of the sodium consumed today comes from processed and packaged foods such as canned soups, deli meats, fast food snacks, and restaurant meals. These hidden sources can significantly contribute to excessive sodium intake without you realizing it. The American Heart Association recommends limiting sodium intake to no more than 200-300 milligrams per day, with an ideal limit of 1,500 milligrams for those with hypertension or at risk for heart disease. Reducing sodium even by a small amount can lead to meaningful reductions in blood pressure. High sodium consumption not only raises blood pressure, but also increases the risk of heart attack, stroke, and kidney disease. Therefore, monitoring and managing sodium intake is essential for anyone with hypertension. To reduce sodium, focus on fresh whole foods like fruits, vegetables, whole grains, and lean proteins, which are naturally low in sodium. Cooking at home allows you to control the amount of salt used and avoid hidden sodium in processed ingredients. Reading nutrition labels is crucial. Choose products labeled low sodium, no added salt, or reduced sodium. Be cautious of condiments, sauces and seasonings that often contain high sodium levels. Using herbs, spices, lemon juice, and vinegar as salt substitutes can enhance flavor without increasing sodium intake. By avoiding excess sodium, you help reduce fluid retention and vascular stress, making it easier to manage blood pressure effectively. Avoid number 2, processed and sugary foods. Processed and sugary foods can significantly contribute to the development and worsening of hypertension. These foods often contain high levels of added sugars, unhealthy fats, and excessive sodium, all of which negatively impact blood pressure and cardiovascular health. Sugary foods and beverages such as sodas, candy, pastries, and sweetened cereals can lead to weight gain and insulin resistance, both of which are risk factors for hypertension. High sugar intake, especially from fructose, has been linked to increased blood pressure through mechanisms involving inflammation, increased sodium retention, and hormonal imbalances. Processed foods like packaged snacks, frozen meals, fast food, and processed meats frequently contain unhealthy trans fats and saturated fats. These fats contribute to the buildup of plaque in arteries, atherosclerosis, narrowing blood vessels, and increasing blood pressure. Moreover, processed foods often have high levels of preservatives and additives that may have adverse effects on vascular health. They also tend to be calorie-dense, but nutrient-poor, displacing healthier options from the diet. Cutting back on processed and sugary foods helps reduce excess calorie intake, improves insulin sensitivity, lowers inflammation, and promotes healthier blood pressure levels. Instead, focus on whole, unprocessed foods like fresh fruits and vegetables, whole grains, lean proteins, and healthy fats. Preparing meals at home using fresh ingredients allows you to control what goes into your food. Reading nutrition labels is essential to identify hidden sugars and unhealthy fats. Look for terms like hydrogenated oils, high fructose corn syrup, and partially hydrogenated fats, which indicate unhealthy ingredients. By avoiding processed and sugary foods, you support your heart, reduce inflammation, and create a diet that naturally helps control hypertension. Avoid number 3, excess alcohol and caffeine. Excessive consumption of alcohol and caffeine can have detrimental effects on blood pressure, making it important to limit their intake if you have hypertension. Alcohol, when consumed in large amounts, can raise blood pressure by stimulating the sympathetic nervous system, increasing heart rate, and promoting the release of stress hormones. It also interferes with the effectiveness of blood pressure medications and can contribute to weight gain, another risk factor for hypertension. While moderate alcohol consumption might have some cardiovascular benefits, excessive drinking significantly increases the risk of developing high blood pressure and heart disease. The American Heart Association recommends limiting alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. A drink is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. Caffeine found in coffee, tea, energy drinks, and some medications can cause short-term spikes in blood pressure due to its stimulant effects. While the impact of caffeine varies between individuals, those sensitive to caffeine may experience sustained increases in blood pressure. Habitual consumption may lead to tolerance in some, but others may remain affected. If you have hypertension, it's wise to monitor your caffeine intake and observe how your body responds. Limiting consumption or opting for decaffeinated beverages can help maintain stable blood pressure levels. In summary, moderating alcohol and caffeine intake is an important dietary strategy for managing hypertension. Reducing or avoiding excessive amounts helps prevent blood pressure spikes, supports medication effectiveness, and promotes overall cardiovascular health. Managing hypertension through diet is a powerful and effective way to support your heart health and maintain healthy blood pressure levels. The Diet for Hypertension focuses on incorporating nutrient-rich foods like vegetables, fruits, whole, grains, lean proteins, and healthy fats, while avoiding excess sodium processed and sugary foods and limiting alcohol and caffeine intake. Making these dietary changes helps relax blood vessels, reduce inflammation balance, sodium and potassium levels, and improve overall cardiovascular function. Small, consistent adjustments in what you eat can lead to meaningful improvements in blood pressure and reduce the risk of heart disease, stroke, and other complications. At Active Healthcare, we're committed to providing you with trusted, doctor-backed advice to empower your journey toward better health. If you found this video helpful, please like, share, and subscribe to our channel for more valuable insights on managing hypertension and living a healthier life. Remember, your diet is a cornerstone of blood pressure control. Start today by choosing heart-friendly foods and steering clear of those that can raise your blood pressure. Every positive choice brings you closer to a healthier heart and a longer life.